Welcome to my Live at 5. I am Dementia Coach Diane, and I am the loving, hopefully, and a caregiver for my husband Ben, who's living with Lewy body dementia. But today we have a special guest coming on, Dr. Dustin Sulak, who is an expert in cannabinoid medicine. So I'm going to give you his official bio in just a minute as people are coming on. Thank you for coming and to be with us here for this live. Just to remind you, if you want to be the first to hear about the live guests that we're having so you can plan to be here on the live event, please sign up for the newsletter at my website, dementiacoachdiane.com. There's a link in my profile. So that way you'll know of all the latest news firsthand. So, again, I am really excited to be bringing on Dr. Dustin Sulak today. He is a traditional osteopathic medicine physician, but also an expert in integrative medicine, and his clinical practice in Maine focuses on treating refractory conditions in both adults and children. So he's also an internationally renowned expert and author in cannabinoid medicine and a co-founder of healer.com, which is an online educational resource. I've used it. Also provides online training and provides a brand of hemp products, which I've also used. So I'm going to bring on Dr. Sulak, and we are going to be going probably for about a half an hour, but we're going to leave some time for Q&A at the end. So please stick around so that you can get your questions answered. I'll try to take some comments as we go, but as I said, I want to get right into this so we can get Dr. Sulak's information and hear all about his success, especially with dementia patients. So here we go. Let me just invite him on. And I'm always praying that the technology works. Let me just get his address in here. Okay, thank you all for your patience as you're coming on. There might be an easier way to do this, but I don't know what that is yet. Here we go. Just bring him on here. It'll take just a minute. Thank you, everybody, for coming. We're so glad to see you.
I need to turn my camera around. Let's see. There we go.
We did it.
All right. Great.
I'm always, kind of holding my breath with the technology, but thank you so much for joining us.
Works. Yeah, I don't see you. I only see myself on here. I don't see you. Maybe that'll change soon. I'm not sure. But am I coming through clearly?
Yeah, everybody else I can see you, Dr. Sulak. Can people give us a thumbs up or a heart and let us know if you can see Dr. Sulak and me? You don't need to see me, actually. But good afternoon, Mary. I see some hearts coming in, so I'm hoping that they can. Oh, we can see you both. Okay, Paul, thank you so much. Yes. Oh, Catherine, looks like you were on here too. Great. Okay, so we are good to go. I did actually give your official bio, and I let everybody know that you do have a practice in Maine where you have been treating refractory conditions in both adults and children. But what led you specifically to become an expert in cannabinoid medicine, and then specifically to look at it for patients living with dementia?
So, yeah, that's an interesting story. I never really intended my career to go in that direction. I think when I was in medical school and in residency, I had an understanding that some of the compounds found in hemp, that cannabinoids, can be very therapeutic. And I kind of imagined that they would be tools in my tool belt. But what essentially happened was, here in Maine, I opened a private practice in 2009. My intention was to do the traditional osteopathic work and the integrative work, which I've done all the way through.
Right.
But that was the year that Maine passed a law that expanded a program that it had for medical cannabinoids in patients. It had kind of a program that wasn't working since 1999. But then 2009, essentially there were thousands of patients in the state illegally using a medicine, and all they needed was a doctor's signature to use it legally. And I turned out to be pretty much the only doctor in the state that was willing to do that. Wow. So it just flooded my practice. It completely took over my career. and I had to rush to the scientific literature to understand what I was working with. And I was actually, even back then, surprised to find how much information there was, particularly from Europe and Israel, on the topic of using the compounds found in hemp to treat people. And then on the west coast of the US, of course, many doctors there that had about a decade worth of experience using this plant. And so I developed some mentoring, and so now I've been doing this for about 15 years. And
Wow.
being an expert in this type of medicine makes a doctor like me a magnet for conditions that don't respond to conventional treatments.
Sure.
And the reason for that is primarily because these compounds found in the hemp plant are targeting a system in the body that regulates and controls all the other systems in the body. It's called the endocannabinoid system. It's the regulator of the nervous system and of the immune system and of the gut and of the musculoskeletal system in a very basic way, a very primordial way. And it's present in almost all animals. So it's a very old system. And because it's so distinct from the pharmacological targets of all these other medicines, people tend to respond to this treatment when they don't respond to conventional treatment. And also it's got a very impressive safety profile. So that's how I got started. That's how I became a magnet for refractory, so-called, refractory conditions that don't respond well to conventional treatments. And my work with dementia started probably about 5 years into my career. And it was, it always, like always, it starts with one patient. I think I had seen some patients with Parkinson's previously and noticed that some of their more dementia-like symptoms were starting to improve. But once I started picking up some patients with typically the more severe behavioral issues, the severe agitation, and realizing that some of the compounds found in this plant could help them calm down, could help them sleep, could make them easier to take care of, and address a lot of the other comorbidities like the pain, and the gastrointestinal, often the low appetite.
Yeah.
And that's kind of the nature of this of these compounds, that they tend to treat the whole person, even beyond what your initial goal is. So I'll pause there and let you ask another question. But that's how I've gotten started. And so I've been treating patients with dementia for about 10 years, and following the scientific literature, which has really accelerated in this topic.
It's so exciting. And so let's talk maybe a little bit more about some of the symptoms that you've specifically seen shift or change for dementia patients, because I know, like, for my husband, his constant movement is something that just pains me, for him. It's almost like he can't sit down. He's not even, and that to me is almost different than agitation. So would you talk about maybe some of the different kinds of symptoms? Because sometimes I think we can even mix up agitation, anxiety, restlessness. I don't even know if that's all the same thing, and then that's separate to me. That's some of the waking symptoms. So let's start with some of the waking symptoms that you've seen improvement with. And go a little bit more specific.
Yeah, so the way I think about it, and I agree that the terms are hard to use and often used inappropriately. There's this kind of comfort or lack thereof of being in one's own skin.
Right.
So maybe you would refer to that as restlessness, or we might call it psychomotor agitation. It's like this need to kind of move about. It's not necessarily in reaction to anything. It's just kind of at a resting state, ongoing level of discomfort. Then there's like a hypersensitivity to things like transitions or caretaker interventions, or changes in schedule or food. That kind of excessive, exaggerated reaction to things where people do get triggered. And maybe that's the word for that might be agitation, but I know
Yes.
none of these words
Yeah.
are perfect.
Yeah. Right.
And so I kind of like separated into those two groups in terms of the more symptoms that are like disturbing the situation. But then there's also the inabilities, the loss of function, which can cause a lot of frustration, especially as people progressing and starting to lose awareness of that progression and lack of an understanding of it. And so that like frustration with the loss of function in life, and I think that there's some grief behind that as well.
Sure.
And what's interesting is that both in my experience and what's been shown in the over a dozen clinical studies that have been done in this topic, there's a much stronger signal at relieving the agitation and that restlessness/irritability, type of symptom. But I have seen in my practice and also in some of the studies, there's a signal of an improvement in the level of function, the functional capacity, which includes even mental status. There's been a couple studies where they've shown an average improvement in mental status, and these are small studies. They're in humans though, and they're often ranging from 10 to 40 people. But when you take an average and a treatment length of usually either 3 or 6 months and seeing that many mental status score improve, that probably there's a secondary effect of being easier to take care of and having less of that frustration around the disability, and therefore the behavioral symptoms improve.
Sure. So it doesn't really matter what comes first, like you said, if the overall effect is some improvement, and then of course it affects the caregiver as well, because it's so hard to see your loved one feeling so frustrated and not knowing how to help them. So it seems like as they calm down a little bit and the caregiver calms down, it has a beneficial effect overall. It kind of feeds on itself, I would imagine.
And I know this is your area of expertise. There's such a reciprocal relationship between, to some extent, the behavior of the caregiver and of the person being cared for, but it's beyond the behavior. It's like their energy, their internal tone, their outlook, their perspective. That energetically is shared among people, and I think that this type of treatment can help break that cycle. It's so interesting. The role of this endocannabinoid system in the body is to suppress excessive activity. When the nervous system is going too much, it turns on and it just brings it down to a normal level. When the immune system is causing too much inflammation, it turns down. It doesn't typically, especially at the right dose, suppress it below the normal level. So it's got this kind of normalizing effect. We call it a homeostatic function of bringing things back to their normal function, and
Wow.
and it really feels like that. That's what's happening at a cellular level. But I think that's what it feels like in the room with people when this kicks in and they start feeling it. And the nice thing is it's not a treatment that needs to be given for months before you see the result. Like, yes, the benefits build over time, but they begin quite quickly. Like as soon as you reach the right dose, a couple hours later, you'll see the improvement.
Wow. And that's, we'd all be thankful for that. And in fact, let's start to talk a little bit about dosing and how would you advise, for instance, a caregiver to start with their loved one, and what about interactions with any medications that they're currently taking? So let's start there. It's like how do we get going? I would imagine a lot of people are saying, yeah, it sounds good. Let's give it a shot. So maybe the first question, let me break it down.
Yeah. So the dosing, like how do you get started? So what I have two roles, kind of two aspects of my career. I'm a clinician where I see patients, and I have this great benefit of spending an hour with them and taking their whole history and devising them a kind of custom tailored plan. And then I also am a part of Healer, which is a company that makes products, and part of our goal is to make safe and effective and accessible products for everyone, and to kind of take the need for people like me out of the picture, because not everybody has access to me.
Yes.
And so I do this like highly individualized piece, and then this kind of cookie cutter piece that we're hoping is an aggressive enough approach to get good results, but a gentle enough approach to avoid the side effects, and a simple enough protocol to make it work. And I think that we've actually succeeded doing that for dementia specifically with a product that we launched just a few months ago called Respite, and it's hemp based, which is nice because it can be shipped to almost every state. It contains a formulation that I came up with based on my experience and based on the research. They're in blister packs, so it's very easy to remember if you've taken today's dose or not. And there's two stages. So we start people on a lower dose stage, and then if by the third or so week, if they're unimpressed by the results and they're not having any negative side effects, then we would progress to stage 2, which is a higher dose, more aggressive treatment for the second month. So, but for people that aren't using our products, like what are the needs to know? So in the hemp plant, probably the compound that people have heard of the most is CBD. It's been getting a lot of attention for the last decade or so. CBD has been studied as a standalone compound in dementia, particularly in Alzheimer's. Most of the studies have combined CBD with THC and have shown better results, but even CBD alone seems to help. It typically needs a very high dose when it's used alone, and then it becomes expensive, and then with that high dose, people end up getting more of the side effects, which are typically gastrointestinal. So by combining CBD with low doses of THC, the cost of the entire treatment goes down. The safety actually goes up because the total number of milligrams is less, and the effects are better, and you get less. You get a broader coverage for some of the less severe symptoms, and also for some of the kind of pro-cognitive improvements that we talked about before. So that's what we've done in our hemp products. The THC comes from hemp, the CBD comes from hemp, and then there's a third cannabinoid that a lot of people probably haven't heard of called CBG, cannabigerol, which is distinct from the other two, and we combine that as well. So this is a product that has 3 primary ingredients. There's a daytime treatment and a nighttime treatment. But just to give people an idea, like if they're not using our product and they want to scribble down some numbers, the data from the clinical trials has looked at doses of THC, total dosing per day, that usually averages out around 7 milligrams. Sometimes it's higher, like you'll see some studies where the average is closer to 12 or even 15 milligrams. In some of the early studies where they were using just pure THC, a drug called dronabinol, that was heavily tested at 2.5 milligrams per dose, and rarely produces any negative side effects. So most people in this field, and I certainly do, think of 2.5 milligrams or 2 milligrams of THC as a dose that's going to be well tolerated by most people. For some people that are concerned about starting there, you can cut the gummy in half or start at 1 milligram. So that's on the THC side. And then on the CBD side, doses that can have some benefit begin as low as 5 milligrams. That study that I was talking about, that was pure CBD, that did show benefit in the clinical trial, that was 200 milligrams per dose. So we like to start off lower, like in the 5 to 10 milligram range of CBD and in the 1 to 2 milligram range of THC, just to give people an idea.
And thank you. Some people are still joining, so let me just re-announce you. I am so excited here to be talking to Dr. Dustin Sulak, who is a traditional osteopathic physician, but also an expert in cannabinoid medicine, and has done studies with the use of THC and the other cannabinoids in dementia patients specifically. We've been talking about how some of these symptoms that we frequently see in terms of the agitation and anxiety, sleep disorders, some of the other behavioral challenges that we all face as caregivers have been positively affected with very little to no side effects, certainly in terms of the use of the gummies that are produced by Healer.com, which is a company that Dr. Sulak is a co-founder of. And so we're just talking right now about the dosing and how to work with something. If you've never worked with THC or some of the other cannabinoids before, they have it all mapped out for you, correct? So could you speak a little bit to that in terms of, I think you have these blister packs actually that are ready to go for people with instructions as well, correct?
Correct. So my experience over the last 10 years treating people with dementia who aren't still living at home is that it can be very difficult to get through the red tape of the facilities. And it's frustrating because we've had such good results with some cases and such hurdles to overcome in order to treat other cases. And so I've been thinking about dementia as this like low-hanging fruit. Like this is a condition that is so prevalent, and really the conventional treatments just don't cut it in terms of pharmacotherapy. I think that we've
Right.
made, with the help of you and people like you've made a lot of advances in behavioral therapy and caregiver practices. But the pharmacotherapy is extremely disappointing and frankly just
The
dangerous.
side
And
yeah, are so scary. Yeah.
right, and it's a trade-off that I hate people to be in the position. If they even receive an informed consent conversation with the medical provider, with the prescriber, which in my experience, a lot of people don't. And I say, well, did you know this is a black box drug? It's got the warning on it that says if you give this to someone like your mom or your dad or your spouse, they are much more likely to die sooner or have other diseases or fall, and that this is very well known. But you have to choose between that and doing nothing at all.
Right.
It's a terrible position to be in. So I've known that there's this other option, and I just want to get this option into people's hands and into their mouths because it's safe. Like you stack it on the table with the other options, and the safety profile is clearly superior, and the efficacy is likely also superior, at least based on the clinical data that we have. So this is what we did. We figured out how to take all of these ingredients from hemp, first of all, instead of from the medical cannabis plant, because that bypasses a lot of the regulations. Now the facilities can treat it just like an over-the-counter supplement. And for people that still have their loved one at home, they can just order it and have it mailed to them instead of having to go see a doctor and get their medical card and then get the
All
dispensary
that.
yeah, and try to figure out what product is right for them. There's just so many hurdles in that. So we kind of cleared all that out of the way and made a simple product that works, but it's more than a product. It's a solution. So in addition to the actual gummies in the blister packs, there's a guide, both for the family member slash caregiver, and that guide includes like a worksheet where you can fill out like numbers on how they're doing. It's a measure that we combine some different standardized measures to create 7 questions that you can check in with and look for if there's progress or if there's a plateau in the progress. And then we also have a clinician's guide that comes with it, so you can give it to your primary care provider or doctor or nurse practitioner, and they can learn about the product. There's an order sheet, so if someone is in a facility and they need an order, which they typically do even for an over-the-counter supplement, they can just sign off on it there. It's got a lot of instructions, and it also has instructions for the staff at the facilities how to monitor the patient and determine if they're responding well to it, if they need to go up to stage 2 because stage 1 isn't strong enough, and so forth.
So, and let me just tell people that are joining now, Dr. Dustin Sulak's with us. He is a DO with a practice in Maine, is internationally known expert in cannabinoid medicine, and is speaking specifically about the use of the extracts, I guess I should say, from the hemp plant in dementia patients, and how they can perhaps give even better results with fewer side effects than a lot of the pharmacological products that we've been using, and that are often where we're not warned about some of the dangers. And so Dr. Sulak is a co-founder of healer.com, which is an online education resource. They have online training, education about the use of hemp, and it's also a brand that you can order the product directly from healer.com. And I believe it also comes with a free consultation from the cannabis trained nurses from Leaf 411, correct? So you
Correct.
can actually talk with somebody, a live person as well, right?
We know, and I think appropriately so, a lot of family members and caregivers have a lot of questions and need reassurance. This is a plant that's had a lot of kind of misinformation and stigma around it. And, back to what we were talking about before, how the energy between the caregiver and the cared for person is so intertwined. We really want people to enter this with a lot of information and confidence and knowledge, about what they're doing, and not just like go out on a limb and say, oh, I'm giving some random hemp or
Yeah.
cannabis product to my loved
Dosing,
one.
dosing
We want you to feel good about it and to have all your questions answered.
Sure. No, that's terrific. And so once again, because I know a lot of people are just joining now, would you just summarize some of the effects that you've seen, positive effects in terms of the use in patients living with dementia, and then also any side effects that we should be mindful of? So, but
Yes.
let's go with some of the positive effects first.
Sure. So, kind of ranging from what most people would consider more severe symptoms, so to less severe. So, literally, like less screaming and yelling and fighting caregivers, less skin picking. And when I say less, I often mean none.
Okay.
So, like a lot of the signs of agitation, the exit seeking, a wonderful treatment for sundowning, kind of smooth that whole process out and erase that. Better appetite, better eating, less restlessness, so feeling more comfortable in their skin, smiling more. I mean, and it's so interesting. A lot of these clinical studies actually include a paragraph or two on the quotes from the caregivers.
Wow.
People are much easier to care for. They're less rigid physically. They're more supple, and then there's the nighttime symptoms. So less nighttime behaviors, better sleep. And that can't be understated, because in dementia, people that aren't sleeping, once you get them sleeping well, not with the drug that makes
They're
it
not,
seem like they're sleeping,
yeah,
but it's not restorative sleep.
right.
Once they get restorative sleep, the daytime symptoms change drastically as well. And so those are, and then, the gain of function symptoms that we talked about. Like, we have a patient now that's using the gummies, or customer, I should call her, that's using the gummies, who started participating in her own bathing again, washing her hair, went from not speaking at all to speaking short sentences.
Wow.
And so the regain of function, which I think in dementia, a lot of, especially Alzheimer's, for years people were saying isn't possible. And now we know that that
It
is
is.
possible, to reverse it and regain function.
Yeah, that is, it's so exciting. It really is. It's just, and but so
So side effects, shall I
yeah,
go there?
and is there, and first of all, is there any reason not to use? Would it be contraindicated in any patients?
There's no firm contraindications to using the right dose, which is what we include here. So someone that's being treated for high blood pressure and being overtreated for it, like if their blood pressure is already kind of dangerously low and they add on these hemp-based cannabinoids, their blood pressure could go a little bit lower, which would be
Okay.
problematic. But I don't want to scare people around that. Drug interactions are really minimal. The blood thinner warfarin or Coumadin
Right.
does interact with this, so that needs to be watched carefully. I know that agent isn't being used as much anymore. And then the drugs that these gummies typically replace, so they can be added to the antipsychotics, they could be added to the benzodiazepines, they could be added to the opioids. So these are drugs like Seroquel or Risperidone, the antipsychotics,
Right.
the Valium class of drugs, and the oxycodones and hydrocodones. The hemp can be added to that, and then the others can be taken
Could
away.
be
But if
taken
you, but
away.
right, so that process requires a little bit of a hands-on, like go up on the hemp, go down on the other.
Right.
And if you don't, if you just go up on the hemp and stay on the other, what's typically seen is sedation. Now, I've been warning people about fall risk with this type of treatment for the last 10 years. It has never happened. And in all of the clinical studies, which are about a dozen studies that are moderate size, not no real big ones, some are placebo controlled, there's been no falls as an adverse effect. And there was even one study that specifically measured the gait of people with dementia after taking THC, and it did not change in a clinically significant way. There was also a study that measured, it was a very in-depth study that measured drug interactions in the human body by giving people a whole bunch of different drugs and
Wow.
measuring their levels in the blood, and there were no significant drug interactions
Wow.
in the body outside of the ones that I've mentioned. So the short answer is no. There's really no firm contraindications here There's just some cases that might need a little more close supervision, and those are cases that our trained nurses could help you identify
Okay,
and kind of escalate if needed.
great. Great, great. So once again, we're talking with Dr. Dustin Sulak. We're talking about the use of cannabinoid medicine in those living with dementia, how we could perhaps decrease some of the um, pharmacological products that we're using as we add hemp-based products, and actually see improvement in symptoms that we weren't actually even seeing improvement on with a lot of the drugs that come with a boatload of side effects. So it's so exciting. And as we said, there's really no reason not to give it a try. So healer.com, let's just talk a little bit about what, again, they can find when they come to the site, and how they would go about perhaps getting hooked up with one of your nurses to really make sure they're getting the right thing for their loved one.
So our main website is healer.com. That's where all of our education sits. And on that website, you'll see a link to healercbd.com. That's where the products live. And so you could just go straight there, healercbd.com, and you'll readily find the product, which is called Respite, Respite,
Okay.
which is, it kind of indicating a respite not only for the patient, but especially for the caregiver. And we're very happy to offer a discount on this product. It's 20% off. The discount code is TRYRESPITE, no space, so it's TRYRESPITE. It's a month supply. You start with stage 1. There's one blister packet for daytime. There's a different one for nighttime. They're different. The gummies are different colors. It's all very clearly labeled. We're making it as easy as possible, and it comes with all the documentation and all the telephone support from the nurses.
Oh, that's exciting. It really is. And I am deeply grateful that you've put so much time and attention into making it easy for us to use something that could really make a difference for both of us. And on that note, could you speak a little bit about the possible use of hemp products for the caregivers? Now, I know that certainly, I know I can't afford to have any kind of psychoactive effect, but I sure would appreciate my nervous system calming down a little bit and perhaps getting a better night's sleep. So could you speak to that as well?
Yeah. Yes, absolutely. So I agree, right? You cannot afford to be impaired. You kind of have to be ready all the time, at
Yeah.
least until maybe things improve a little bit with the use of the respite gummies. So probably my top choice for caregivers who are feeling overwhelmed and frazzled and kind of deficient in their self-care and maybe deficient in sleep is going to be the CBG, cannabigerol. And that's something that a lot of people haven't heard of. It's very different from CBD, actually comes from the hemp plant as well, but it works differently in the body. And it's relaxing without being sedating, and it's completely non-impairing. You could drink, the whole bottle and not get the THC
Sure.
psychoactive effect. So that's a nice place to start. I suspect that a lot of people have tried CBD before, and probably a lot have been unimpressed with it.
Yeah.
That typically happens. It's weak, honestly. Like for some people, they respond great to low doses of it, but a lot of people, if they would keep cranking the dose up, eventually they might get some benefits in terms of anxiety or physical pain relief. But the plant
Okay.
actually gives us non-psychoactive compounds, non-impairing compounds that are better at achieving those goals of pain relief, stress relief, better sleep than the CBD is. And so CBG would be my top try. We have CBG drops and gummies and capsules. So whatever format is the right, the one that you prefer. That would be my top recommendation for caregivers, and I think it'll be something new that a lot of people haven't tried before, and it's effective at much lower doses than CBD.
Yeah. Oh, that's so good to know, because I couldn't decide if it was because I was a child of the 70s and I kind of liked the psychoactive effect. Like when I tried the CBD and it didn't do anything after a month or two, I was like, huh. But the CBG, it sounds like a whole new world for us to dive into as caregivers, and also to help our loved one.
And I do want to say something else about THC. It requires knowledge and precision But with THC, there's almost always what we call a therapeutic window, where here's a dose that's going to help with sleep or help with stress, and here's a dose that's going to make someone impaired in a way that's going to make them not as good at being a caregiver. And
Sure.
there's a window in there. There's room in there. And so if people start at a low dose of THC, like we have hemp gummies that have very low doses of THC. One is called the Zen gummy. Each gummy has 2 milligrams of THC in it. You could easily start with a half or a quarter of that gummy, and it's not going to put anyone above that threshold of being unable to be a good caregiver, and then gradually work up, especially for people like you mentioned that used to appreciate the effects of THC, but know that they can't appreciate it in the same way anymore. But you have different needs now than you have. Back then you wanted to get high, now you want to just feel like yourself and feel relief.
Yeah.
And so that's also an option. And THC and CBG combine very well together.
That's great. That's good news, you know. So I'm going to be doing my own clinical trial and reporting back to the community. So, and I'm hoping that others will take your advice and give this a shot. We've been talking with Dr. Dustin Sulak. He's been so informative. He is co-founder of healer.com. It's sorry, was it healercbd.com to go right to the products? Did you say?
Yes.
Correct. Yeah. Okay. And but it's an online education resource. They have online training, and they also have a brand of hemp products. And it sounds like many options for both the caregiver and our loved ones living with dementia or some other conditions that might really be helped by the calming effects of the hemp products and effects on sleep, effect on agitation, anxiety, pain. And so the beautiful thing is that if you go to their site, you can also sign up for a consultation with a nurse trained in the use of cannabis, so they can guide you depending on the conditions that your loved one is living with, to which products might be the best ones to start with, and to guide you through the process. So you're not alone in this experience, which I think is the most exciting thing, because too many of us can feel isolated out here and are not sure, where to start. So the question said, if it isn't available in Canada, is there anything that is available in Canada? Do you know offhand if there's any challenge with getting the products to Canada?
I don't have a lot of hands-on experience with that, but I know that there are cannabis products available in Canada. And so you could look at our website and see what we designed with the respite line and just do your best to mimic that with what's available locally. You may need a doctor to prescribe it, or you might not, but I suspect that you're going to be able to do this in Canada as well.
Yeah.
And then I see the next question, which is, can we get it in New York? Which is unfortunately no. I think there's 7 states that have passed laws restricting the amount of hemp-derived THC that can be in a product. And so New York is a no state, unfortunately.
Wow, I did not know that. I'm surprised. Okay, thank you. Please, though, we have a few minutes, I think, for some questions. If some others have anything that we can answer, please put the questions in the comments. And we're talking with Dr. Dustin Sulak, who is an expert in the use of cannabinoid medicine and also integrative medicine. And we've been talking about the use of hemp products in our loved ones living with dementia. And as I said, perhaps other conditions where you're taking care of your loved one at home. You get to the point where you don't want to add another pharmaceutical. The ones that we're using are either not working or having more side effects than beneficial effects. And now we have some alternatives and some guidance for how to use the alternatives. What about New Mexico? Is that, do you know
I believe New Mexico is fine. On our website, of course, it'll list those 7 or so states. Maybe I can mention them. Someone just asked. Yeah, let me pull it up real quick. Or if someone from the Healer team can put it in the chat, that might be easier. While I while I let someone answer that question for me, thank you, Healer team, if you can do it. The one other thing that I didn't bring up here that I want to is that there's a huge amount of animal research into this topic, like huge, and I think eventually it'll lead to drug development using isolated versions of these compounds for the same purpose. The animal research is profound. Now, not everything that we can do in dementia models in rodents translates effectively to humans, but there is a very consistent signal there of reversing the disease, of lowering the amounts of beta amyloid plaque, lowering the amounts of tau protein tangles, improving the rodent's ability to complete mazes and doing other cognitive tests. It's overwhelming, this disease modifying effect. So while we're using it clinically to help with the symptoms, the real question is what's underneath that? And what could we be? And none of the studies are long enough. I think the longest study we have is just short of 2 years. It's hard to know, and of course we don't, get the autopsy data and stuff like we do in the rodents.
Sure.
But this is the big question that needs answering. Like, are we not just treating the symptoms, but are we potentially halting the progression of the disease, or even reversing it in some patients?
That is so exciting, and I am so grateful for your time and sharing this information with our community, who has been, I think, I know for myself, sometimes desperate to help, our loved ones, and just don't always know how. And the last thing we want to do is, up the pharmaceuticals that have those black box warnings, in terms of increased morbidity and mortality. So this has been a wonderful discussion with Dr. Dustin Sulak from healer.com. He's please, if you're just joining now, go back and watch. He's shared so much information about some of the symptoms that can be possibly decreased in terms of our loved ones living with dementia, in terms of better appetite, better sleep, a decreased effect of some of those aggravation, anxiety, and anger that happens oftentimes during sundowning, just an ability for them to feel more comfortable in their own skin. And as our loved ones can calm down, as their nervous systems can calm down, it can help our nervous systems calm down too. And our interactions, of course, can be what we want them to be, which is as loving as possible. And
Right.
Dr. Sulak also spoke to the use of some of these products for caregivers as well, that we can use some of these products for our own nervous systems without impairment. So without the psychoactive effect. So this session has been filled with information, and I'm so grateful. There's also, again, you can go to healer.com. You can get a session with a nurse trained in cannabis. You can talk about your loved one, what medications they're on, what conditions they have, so that you feel comfortable getting started with the use of hemp products. They have blister packs, instructions, everything you need to get started safely and to really give this product a try in your loved one. And also, would you give the, I think it's Try Respite was the coupon
Yes.
code, 20%
Yep. So
off?
if you go to healercbd.com, all one word, Try Respite, no spaces, that's a 20% discount on your first month with this product. For the caregivers, if you're not sure what product to pick, probably my top choice is something called the Relax Gummies. That's the CBG in the gummy form. And I saw some questions pop up here. Is this product good for pain? So yes, it absolutely is. The respite gummies I use in my practice to treat elderly people with pain who do not have dementia. It's a great treatment for pain. If you're treating the behavioral symptoms in dementia, you're also going to be treating the pain at the same time, also treating the sleep disturbance and the anxiety. It's just a holistic, whole person treatment. I also briefly just saw the question about autism, which is so interesting you asked that, because we have been using this product in patients with autism as well, who face similar hurdles when it comes to getting a product into a facility for the adults with autism that are living in group homes and things like that. And this gets through there, and it's a wonderful product for autism as well.
Thank you so much. And I'm so grateful again for this opportunity again to interact with you. And I think we're going to be having some other members, perhaps from Leaf 411, are going to be coming on in the next couple of weeks. So please, everybody, stay tuned. Sign up for my newsletter if you haven't already. You can go to dementiacoachdiane.com. It's a free newsletter, but you'll be the first to know about other live guests coming on board. And as new information comes out, even, I will feed it to you the best I can. But Dr. Sulak, thank you so very much for your time and your information and your passion and how much you care about making a difference for not only those living with dementia, but those of us that are all getting older and want to do it in as graceful and healthy a way as we possibly can. So,
Well, right back
God,
at you, Diane. Thank you for the love that comes through in your videos. I wasn't aware of your work before we set this up, and now definitely every family that I treat is getting your link because the work you do is fabulous, and it just comes across with so much love. So thank you for that.
oh, thank you. Thank you. Thank you. So, and thank you to this wonderful community. Thank you for everybody that's joined us. And please, again, spread the word. Let people know about this video so they can really hear more about what's possible. This is exciting new stuff and new things that can help us and our loved ones. So with that, I will say thank you, goodbye, and God bless.
Same to you. Bye, Diane.
Bye.